Health experts have warned shortages of some medicines are putting patients at risk.
Hospitals and GPs under unprecedented pressure.
Pharmacists have warned that patients are at risk of immediate harm and even death.
What would you do if the medicines you rely on were suddenly hard to find? This isn't a hypothetical question. Many in England are in the throes of an unprecedented medical crisis.
I've got one more pack left and I have to take them every day.
These tablets are essential to Charlotte's survival. She's been living with epilepsy for 20 years. She has to take 2 tablets a day to manage it, but a national supply shortage means she's having to ration what she has left.
From children needing asthma inhalers to elderly individuals requiring daily diabetes medication, the UK has a medicine shortage. Community Pharmacy England reports that the drug shortages have become a daily struggle, affecting essential treatments across the board. In 2023 alone, the frequency of these shortages more than doubled compared to previous years. And the pharmacists have been expressing their frustration as they find themselves firefighting in the background, with patients' health increasingly at risk due to these unavailable medications. So there are multiple causes for this. COVID-19, and there's also the impact of war, both within the Middle East and within Ukraine. However, for this, I'm just going to be concentrating on Brexit, as it is self-inflicted. The other thing? In December 23, I travelled around Europe and I went to pharmacies asking if they were suffering from shortages. France, yes. But when you dig deeper, you quickly find it's down to the price caps and the French pharmaceutical industry selling it abroad for a higher price. Italy, Spain and Germany, I didn't see any problems. Pharmacists were looking at me quite quizzically as to why I was asking these questions, to which I had to explain that Britain was suffering from a medical shortage. The shortage situation is dire and it's affecting more than just supply, it's altering the fabric of healthcare interactions. Pharmacists have reported a dramatic increase in patient aggression driven by fear and frustration over not being able to access necessary medications. Instances of shouting, swearing, and even physical assaults are becoming more common, placing additional stress on pharmacy staff who are already under significant pressure. Over 84% of pharmacy staff have now said they've experienced aggression from patients. That's according to the CPE. Finn McCall, the owner of an independent community pharmacy in Greater Manchester, had this to say.
Most people are very understanding, but they are worried and frightened, and inevitably sometimes that boils over, and we have people taking it out on us. We have had patients being annoyed and angry and occasions of people spitting at us. I regularly have staff in tears by the end of the day because of the sheer pressure of it all.
The CPE, Community Pharmacy England, which represents over 10,000 English pharmacies, did a survey of pharmacy owners covering 6,100 pharmacies and 2,000 of their staff. And have a listen to what it found. 79% of pharmacy staff said that medicine shortages were putting patient health at risk. 91% of pharmacy owners had seen significant increase in the problem since last year, 2023. 99% of pharmacy workers found a drug was unavailable at least weekly, and 72% encountered that several times a day. The shortages are further compounded by other growing crises, in part caused by Brexit. Within the UK's pharmaceutical sector itself, the country faces a significant brain drain, with skilled professionals emigrating in search of better opportunities and lifestyles, which of course is impacting the healthcare system's efficiency and responsiveness. Something that I brought up in previous videos like this one. This exodus isn't limited to pharmacists. The UK's pharmaceutical labs, crucial for drug development and supply, are also understaffed. Currently, the UK has only 2 major pharmaceutical labs capable of supplying the entire country, a number far too low to meet the demand. With 600,000 Britons leaving each year, the healthcare sector ability to function effectively is severely jeopardised. Unless we come up with a very quick solution, we're going to be running into further problems. The pharmaceutical industry reports a troubling forecast. Job vacancies in pharmacies are set to increase by 6.9% by 2027, creating around 4,700 new positions that need to be filled. At the same time, more than half of the existing workforce is expected to retire, potentially leaving a staggering 35,600 positions unfilled. The sector's capacity to innovate and respond to shortages is at risk, exacerbated by an ageing workforce and the migration of young talent abroad. If these trends continue, the UK could face a significant shortfall in the number of pharmacists, further straining the ability to distribute and manage drug supplies efficiently. And that leads on very nicely into what are the solutions. Well, obviously building more labs would be a good thing, recruiting more staff would be a good thing, but the government is limited in its budget. That's been constrained in part due to Brexit. And on top of that, it doesn't even include the drop in the pound and the effects that's had on importing goods. So if we're not making it ourselves, we're importing. If the pound goes down, and it went down significantly, it hasn't really recovered, that has added an extra 20% of cost onto our pharmaceuticals. So an obvious solution would be to start rejoining the EU. Even by declaring it, the pound would increase in value. And as stated earlier, we could do with 2 more pharmaceutical labs being built in the UK. The problem is not only the brain drain and the money, it's also that we've got a very, very lazy, somewhat hippie-esque, yuppie-esque government that just doesn't want to do any work and leave it to the private sector, and the private sector is not filling that void. There's always the ability to get rid of red tape, but that then comes with risking people's lives. So we could get rid of restrictions and trying new drugs and bring them into the UK. But of course that increases the risk with that drug if it's not tested and checked before being released into the UK public. They could also create a more robust support system for pharmacies struggling financially due to the discrepancy between the cost of purchasing the medicines and the reimbursement received. This could take away just a bit of pressure. And finally, education. But we know for a fact that Rishi Sunak doesn't like people having a university education because it doesn't transfer into votes for the Conservative Party. But if the government were to invest in scholarships and better career progression opportunities and enhanced working conditions, anything to support the pharmacy sector, this could have a huge beneficial effect on the UK. Whether or not they'll do it is a different matter. So let us know your thoughts and join the conversation inside the comments section. Once again, I want to say a big thank you to everyone who has been supporting the channel with Patreon and YouTube, and even buying me the odd coffee. If you'd like to do the same, links are in the description. Once again, thanks for listening. Bye for now.